Now it is recording. Before we start, let me give the link in the WhatsApp so that some people, those who cannot join, they should join by the meeting link. I gave the link to the leaders. If somebody is not able to join, if they contact you in the group, please send them the link. Okay.
Yes, Doctor, it's already sent it.
Yeah. Okay. I will start my lecture now. Bismillah ar-Rahman ar-Rahim. Now you can see my PowerPoint, I hope.
Yes.
Okay. So Bismillah ar-Rahman ar-Rahim. Continuing professional development. I put one Arabic translation for it. Maybe it is not exactly, but what I found it on the Google Translate. Al-Tatwir al-Mahni al-Mustamir. You are developing yourself continuously, not in 1 month or 2 months. Continuously, while you are practicing your profession, you are learning something. That is called as continuing professional development. So, definition. What is the definition or what is the meaning of continuing professional development? As the slide says, and it is the same, like is the means by which people maintain their what? Maintain their knowledge. The important words in this are maintain the knowledge and skills which they gain while they get educated or while they get the degree. So that is called as continuing professional development related to their professional life. We are not talking about, sorry. So maintenance of the knowledge. Suppose you learn something in your second year MBBS, third year MBBS, final year MBBS. That knowledge you have to, after some times, you will start to forget. How you will remember? You will remember it by practicing. Either you learn it by reading or either you learn it by doing. So if you are continuously doing or repeating that knowledge, then only you will be keeping or maintaining that knowledge in your future life. So whatever things you do to maintain what you learn during, let's say, during your MBBS period, when you become graduate, you are called as MBBS doctors or general physicians. Once you become MBBS, you have gone through anatomy, physiology, biochemistry, pathology, many treatment or pharmacology and all these things. But how you are remembering it in your future life? By reading it again and again, by doing it and by revising it throughout your life. Not only by reading, writing, but while practicing. So these things are known as continuing professional development. You go on keeping this knowledge. Now, suppose in 2025, some theory was proposed how the disease happens. Maybe after 10 years, this theory will not be the same. They may have added some new drugs. They may have added some new pathogenesis or maybe pathophysiology. They might have found some new genes which is responsible for this disease. So how you will learn? You will say, no, I learn it in my first MBBS or second MBBS. This is the gene responsible. No, you have to update your knowledge. You have to update your knowledge according to the new inventions which are going on and which are the scientists are doing. That is called as continuing professional development. So definition wise, continuing professional development, or in short form, it is known as CPD. Continuing professional development is defined as the education, whatever education any doctor will follow after completion, after finishing, not during MBBS, but after finishing the MBBS of their final training. Whatever education you come across or you learn after your final degree is called as continuing professional development. So it consists of any activity which is helping them to maintain, to develop or increase new knowledge, to develop the problem solving skills, and to develop some technical skills. Maybe you did not learn about new technology during your MBBS life, but after you graduate and after you are coming in practice or you are performing your duties, you learn something new, how to handle computer-based education or use of AI during diagnosis and all these things. You learn it by after the formal MBBS degree. This is called as continuing professional development. Why everything? Why you should keep on learning? Why? What is the reason why one should keep on learning? The aim is to provide better healthcare. Suppose you become doctor and you don't learn new techniques, you cannot provide better healthcare. So all the final goal or final, you can say the aim of all your activities, why you are learning, why you are attending conferences, why you are attending new seminars or workshops after you already graduated. But why you are learning new things? To provide good healthcare to your patients or to your society, to your country. This is the aim. Aim is not to gain money, huh? Be careful. Not to gain extra money. This is something which will come automatically, but this is not the aim. Extra money or what you call financial aid, finance. Money will not be the primary goal of whatever you learn after your education. Please keep in mind, your aim is to provide better health facilities to the society, to the patients, to the country. And that's why you keep on learning. This is the aim of continuing professional development. Okay, this is the aim. The aim is to provide or improve. First of all, you should maintain. You learn something, after sometimes you start to forget. But you to avoid this forgetting or to maintain it, and also to add something onto the previous knowledge, whatever you do to provide a quality care to your patients and the public and the society, this is the aim. This should be your aim, that you are learning something. And also the standards of the team. Maybe you after graduation you will be working in Ministry of Health, or you may be working in some hospitals which consist of uh, nurses, which consist of technicians, which consist of some community health workers. All these workers are part of your team. So you have to be good relation with them. You have to have good relation with them. And how you will learn? You will learn by learning new things and helping them. So to have a proper teamwork and collaborative work, this is the aim of the continuing professional development. Your CPD activity, suppose I become a doctor. Now I learn some new things after finishing my MBBS. What should be the aim? The aim is I want to keep my knowledge up to date. What is mean by up to date? Up to date means what?
New دكتور. New
Hmm?
دكتور. Keep it new.
Keep it new, jadid, tajdid, hattal an. Till today, what is correct, I should learn. What I don't know, maybe I don't know the cause of corona disease, or how the coronavirus is produced or how it transmits. If I don't know, I have to learn, because this is just now came in the education or in maybe in the society. Suppose new virus came. I have to learn about this new virus. Maybe I learned it in my books. But what is current at present? What is the theory? What is the treatment? That thing which is at present or hattal an, I have to learn about that. This is known as keeping the knowledge up to date and competent in all the work you do. You should remain competent. You should not tell, so no, I don't know about this. You don't know because you don't have knowledge. So please gain the knowledge, learn it by attending seminar, by reading the book, by going through the internet, and then you should become competent. What is competent in Arabic? Competent. Word competent, because I came to know from your responses in the previous exam that you know the answer, but you are not knowing the English terminology. That's why you did not put the correct answer. So that's why anyone who knows competent, please translate it in Arabic so that all other people should know. You should be competent in all your work you do. Perfect, yani, perfectness, competentness. You should be perfect in your knowledge. Should be able to do everything. It should affirm that what you do well, address areas of requiring improvement and explore new knowledge. Suppose after MBBS, I found myself that I am weak in handling some patients with certain disease because I did not read it while I was preparing for MBBS exam. So I have to learn that thing. Maybe it is a new technique which I don't know. Maybe a new treatment which I don't know. Maybe some electronic instrument which I don't know how to handle it. That thing I have to explore. I have to find out that I am not in perfect in this area. So I have to learn after I graduate. This is called as continuing professional development. So it is not only about knowledge, it is about skills, it is about behaviors also, improvement in all areas. Who will tell me that you should learn number one thing, number two thing, number three thing? Who will tell me? Any idea? After I become a surgeon, who will tell me that I should learn this thing? I should learn this technique. I should learn this methodology. Who will tell me?
Yourself.
Yes, I myself analyze myself that I know these things and I don't know these things. So these are my weaker areas. I have to come over this weaker areas. So this is the responsibility. Only you are the responsible. As a physician, as a person, you are alone responsible for whatever things you have to learn afterward. And that's why you have to plan. If I found something that I am not good in research, let's say I am weak in research, how to find out the cases, how to analyze it, statistics, how to conclude, all these things. If I don't know, then I have to attend research workshops, techniques I have to attend. Maybe I read these things in the book or maybe on internet or maybe some seminars are going on. So I have to attend myself in that seminars. So planning what areas to be improved, this is my responsibility. No one will tell
Good
me.
sir.
Yes.
Are you moving with the slides, or are you still in the first slide?
No, I'm moving. This is now my slide
Because,
says responsibility for personal learning.
because on the dashboard you're still in the first slide.
MashaAllah. So
You're
okay,
not
good.
moving.
I will restart again because this is the problem in Teams. I don't know why it stuck. Thank you for reminding me.
Welcome, welcome.
This is the fifth slide. I was in fifth slide.
Now it's clear, Doctor.
So I am the one responsible as a physician, as a surgeon, as a general practitioner, as a doctor. I am the one responsible for identifying my weaknesses, identifying my areas of improvement, and accordingly, I should plan. Maybe in first 6 months, I have to do this workshop, this technique I have to learn. In maybe next 6 months, I have to learn some new other things. So like that, I am the one who will plan myself and learn new things after my graduation. My slides are not here now. Okay. So identification of the need. The slide is moving now.
Yes.
Yes.
Okay. So let's say whatever the new techniques I want to learn, this is called as a new CPD, that is continuing professional development activity. Suppose I need to learn about some research technology or maybe some computer technique related to my profession. If I want to learn this activity, then I have to identify that I am weak in this. And then accordingly, I will plan maybe during summer vacation, maybe during January, maybe during any month, I will register to this activity and I will do it. So identification of the need. First of all, I have to know whether I am perfect in this or weak. If I am weak, I have to plan for improvement by whichever free time I have to attend this type of activities. And this is related to our professional need as a doctor, what I have to learn, and as well as what people want. It's not only that I am weak in this. Let's say I am weak in research, and in that area where you are practicing, people need a general physician who can handle cases related to pollution or cases related to some specific disease. So it is the importance of people. Like my patient need what my patient need. My patient need a doctor who can address their problem. So their problem, if I know how to handle it, it's okay. If I don't know, then I have to learn. So most important thing is that first of all, I have to decide which area I am weak in. And second thing is what the people wants, what my patient want me to do. If the patient want you to do the surgery with the help of like endoscope or like if they like to have new technology and if you don't know, you have to learn it. So it is the demand of who will demand? It is the demand from my patient, my demand from patient, peoples or those who are in coming in contact. Okay. So this is the demand from the patient or the people in my area or with whom I am coming in contact. So it is the people's demand which is deciding that I should learn some new things. Okay. Not my own personal gain or I want to have more money. It's not the primary. It is obviously it will come. Now, after I learn some new things after my graduation, suppose I learn research technology. If I learn, suppose some computer technology related to healthcare or some robotics or handling with new technology, it has to be reflected, seen in my practice. Before the practice, I was not doing it. After the practice, after I learn, after my CPD, I am doing it. So it should be seen in my practice. This is called as reflection. Reflect in your practice. Reflect in my day-to-day practice. Okay. Before I was not handling or not using computers for treatment of the patient. Now I learn computers, so I am utilizing it for the better healthcare facility for my patients. So this has to be seen, should be very obvious in my practice. This is the outcome. After I attend any activity, CPD activity, then I have to apply in my day-to-day life. This is called as the reflect in my practice. Okay. So from where the motivation will come? Why I should learn something new? This motivation will come from the professional drive. I am a surgeon, so I should learn some new techniques. And also my patient, what they demand, then I have to learn that things. Also, it may be the demand from employer. Suppose I am working in a very hi-fi hospital, very technically to the par level hospital. Suppose the hospital is using all sorts of new technologies, and I don't know. If I am the employee, if I am the employee of that hospital, I should learn how to use that instrument, how to use that technology which is present. So it is the demand from employer also, patient also, and society also. All of them will make me learn new things. Okay. So CPD drive should come from the patient, from your employer, from your society. And also to avoid burning out. What is the meaning of burning out? Means suppose I am doing one type of surgery. Let's say uh, I am doing some heart surgeries. Okay. Every day I go to the hospital, I have a new patient, I do surgery and come back. It will become a routine for me. It will become a routine for me, and I don't like it after maybe 1 year or 2 years. So I will not pay attention. How I can have my interest in it? I have to improve it every day. I have to improve it so that my knowledge should not be burned out. My knowledge should not be burned out or goes away. I have to be satisfied. What I am doing every day, same thing? No, I have to try something new, something better. Otherwise, it will become a very boring life. Every day you are going and doing the same thing and coming back, going to the hospital, doing the same thing and coming back. Everything, if you try new things, newer things, so that time will be saved, money will be saved, patient will be more satisfied. These things, if you are trying, then you will like your field or your subject. That's why to avoid burning out also, you have to go through continuing professional development to avoid. Otherwise, you don't like your specialty maybe after some time. So up till now, we covered that what is the meaning of continuing professional development, who will tell me to do it, and what should be the motivation for it, we have covered. Now, actually, CPD means it is a self-directed learning. Nobody will give me an admission to the university again. There is not formal admission. No admission will be required in any sort of program. It is practice-based learning. You are learning in your day-to-day life. Self-directed. It is self-directed and practice-based learning, not a supervised training. No lecturer or no professor will teach you every day. You have to come to my class and then you have to spend, and after 6 months you will learn. No, it's not like that. It is my own efforts to learn new things. This is called as CPD. So CPD is continuing professional development. It is the activities you learn after your graduation to improve your knowledge, to provide better health care, and it is self-directed learning. It is not a proper type of education that you take admission and then you learn. Okay. So this is the main difference in normal education and continuing professional development. Okay. Now, up till now, I told you learn something like that. But from where I should learn? Who is going to give me that knowledge? That is called as CPD providers. Who is the provider of your CPD activity? Who provide me CPD? Continuing professional development activities. Who provide? The one is in medical colleges and universities, there are some lectures, seminars, workshops going on. Not for the students, but for anyone who is from outside. They can register, they can pay the fee, they can attend, and they can take the certificate. Maybe it is 1 day workshop, 3-day workshop, 1-week workshop or seminar, something like that. Okay. So medical colleges or postgraduate institute, maybe professional organizations. What professional organization? Maybe Saudi Heart Association. Example, I'm giving you example. Saudi Heart Association, or maybe any, let's say, any Saudi Cancer Society. Saudi Cancer Society. There are some societies and some organizations which are providing new activities, or maybe National and International Scientific Organization, World Health Organization, WHO, World Health Organization, arranging some seminars, arranging some activities, or Ministry of Health, here local authorities, here MOH, Ministry of Health, Ministry of Education, maybe MOE. They are arranging some seminars, some workshops for doctors, for students, those who are already graduated. Okay. Even some of the companies like drug companies, pharmaceutical company means drug companies. They are like say Tabuk Pharma or Al Jazeera Pharma or Pfizer or something like that. They are arranging some seminars, some activities, or maybe medico-technical industries, those who are providing instruments, ECG instrument or operation theater instrument. They are arranging some workshops, hands-on training. They are the one who will provide these activities. So from there, maybe on the website you have to see, maybe in some news coming in the newspaper, or maybe in your email, there is workshop is going on in health education, something, you have to register. These are the provider of CPD activities. Now, for any activity to be formal, it has to be accredited. Accredited. What is mean by accreditation? Accreditation means what in Arabic? I think etemad. Is it etemad, accreditation?
Yes.
Yeah. So
Yeah.
somebody should keep the record of these things. Suppose any organization is arranging, then some other authority should look upon it. What is this activity? Is it good, bad? How it has to be arranged? So some checkpoints, check should be there, and this check is done by some authorities like Ministry of Health. Under Ministry of Health, they are looking for such type of activities. Maybe Saudi Commission for Health Specialities. Saudi Commission for Health Specialities. تخصصات السعودي المهني. So Saudi Commission for Health Speciality looking for any activity arranged for improvement of the doctors. They will see it. Is it good, bad? Who is providing? What is the knowledge to be given? All these things are to be checked and approved. This is called as accredited activities, and it will allow you how many hours of activities you have done. Maybe they will give you for 1 day activity. Suppose this is the whole day workshop. They will give it, let's say 3 hours, 3 CM credit hours, 3 credit hours, something like that. Or maybe it is a 1 week workshop. They may give 24 credit hours, something like that. So these are hours called as points. You have to arrange or count these points, hours or points. So any doctor who is attending these workshops or activities, he is getting points or credit hours, and he will keep it on for its renewal as a license. Let's say I am a Saudi health license. I have got Saudi health license. So after every 3 years, they will count my points. How many points you have covered in 3 years? They require, I think, at least 30 credit hours per year. 30 credit hours per year. So 30 activities or any activity which is giving them 30 hours should be calculated for their renewal. Okay. What is personal portfolio or logbook? Or logbook? Yes. Let's say you have a file. a folder. Suppose you have a folder like this. I will draw the folder. In this folder, you keep the record of all these things. How many activities I have done. I will keep all these papers in this file. This is called as my portfolio, professional development portfolio or logbook. I will record them. This is called as professional development portfolio or a record or logbook. There is one term which is coming in same in interchangeably used. This is called as CME, continuing medical education. This is describe continuing, C for continuing, M for medical, and E for education. Okay, this is E. This is C. So CME. CME stands for continuing medical education, which is not same like CPD. So CPD and CME are not same. They are slightly different. Continuing medical education or CME is only related to knowledge and skills in medicine. Knowledge and skills, two things. One is knowledge. Second thing is skill. If you are learning new knowledge and you are learning new skills related to your medical degree or medical practice, this is called as CME. This is called as CME. Whereas CPD is a broader term. Let's say this is CME, okay? CME, which is having two components, knowledge and skills of medicine. Whereas CPD is bigger term. It is multifaceted competencies inherent in medical practice, covering wider domain of professionalism. So it includes medical, managerial, social, personal subjects needed for high quality. Maybe requires let's say teamwork or communication or management, and also knowledge and skills. All together, this is known as CPD. So CPD is a big term. Of that, CME is one part. CME is knowledge and skills. So knowledge, skills is only related to CME, whereas other things other than knowledge and skills and teamwork and managerial communication and leadership, all these are together, all is known as CPD. So anything which is improving your professional life is called as CPD. Anything which is improving only your knowledge and skill, it is known as CME. Got my point?
Dr. B referred for professional.
Yeah. So let's say this is the big area is called as CPD. In this, a small area related to knowledge and skill is CME. Two things only. Okay. So CME is a part of CPD. So for any CPD activity, it has to have a professional activity. It has to have required for maintaining the good medical practice. It is related to the patient care or relation with the patient care, and it is along with the interpersonal skills like working in a team or with your colleague. It has to have some teaching and training activity, and it is improving your health. Probity and health is just improving health. All these are the contents. If you are having, it is known as CPD activity. It is related to professional practice, not only knowledge and skill only, but all professional activity. It is required to have good maintaining the good medical practice, relationship with the patients, relationship with the working with colleagues. All activities related to all these points, 6 points, is known as a CPD. So ideal CPD activity should have, suppose I am arranging a workshop for the doctors for, let's say, one whole day. From 8 o'clock in the morning till 4 o'clock in the evening, I am arranging some lectures, some hands practices. If I am arranging, so that day activity should have certain criteria, some characteristics. What are the criteria and characteristics? It has to have a mission. What is the mission of this activity? What is the why we are arranging this activity? Maybe to improve the research skill, maybe to improve teamwork in doctors, maybe to improve communication in the doctors. This is our aim or mission or outcome. What will be the learning method? How this activity will be done? Is it only lectures or some hands-on practice or use of some technology, hands-on, or some workshops, some practical sessions? Are these? What are the methods? What methods? 1, 2, 3 methods will be utilized. What are the documents? Have you announced? There is a schedule, there is a CME application, or you can say the Saudi Commission application. Who is benefited with this activity? Who will be the person who can attend? If you see any advertisement, they say this is the aim of this activity, that you should learn at the end these things. Who are eligible for it? Maybe nurses, maybe doctors, maybe students, maybe professors, maybe surgeons, like that. So who is the individual doctor? Who is going to provide this? Which professor, which organization is providing this activity? What are the resources used for this activity, and what is the context in the education? How this activity will be going to be evaluated? Is it going to be having an exam at the end, or just feedback, something like that? And how will be the organization? What will be the place? What is the timing? Which area, which hall, something like that? And for this type of activity, suppose one of the example is basic life support, BLS. All the doctors must do it. But suppose I did it today in 2025. In 2025, is it enough for me to have the same activity for coming 10 years? Is it like this? No, I have to renew this BLS activity again in after 2 years, maybe 2027. I have to do it again. Otherwise, this will not remain valid. So continuous renewal of this type of activities has to be there. Some surgeons, some pediatricians, some anesthetic workers, they have to go some courses every 3 years, every 2 years, so that they will be remain competent in that area. So is there any renewal technique or not? Okay. Now, as I told you, if you are you decided that you learn something new, so you are keeping the record in a folder. In a folder, you are keeping all these documents. I will put certificates of attendance, certificate of appreciation, all these things. This is known as personal development portfolio, PDP, personal development portfolio. Here it is the folder or a file. It can be electronic also, not physical. Maybe it is electronic in your computer or in your drive. It can be where you will keep these files. Let's say I attend a seminar and I got a certificate. So this is certificate 1. Similarly, certificate 2. Similarly, certificate 3. All these for 1 year, maybe you are keeping all of them arranged in a file or a folder. This is known as personal development portfolio. Whenever you are attending such activities, you should keep a record of it. You should keep a record of it as an evidence. This is a evidence, shahada, that you have already covered these many activities in 1 year, 2 year, or 3 year. So that whenever you are planning for new thing, you will see, oh, I already done this, I already done this, I already done this. So maybe new things I have to attend now, or maybe it is already expired, 2 years are already gone. Then only you will come to know that it has to be renewed. Okay. So this record is known as personal development portfolio, or simply logbook. This is a logbook, what you are recording in it. Now, if you keep this logbook, is it good? What is the advantage? What are the advantages of keeping all these records? What is the advantage? The advantage is that it is at one place. You don't have to think and search for it. What I did in last 6 months or what I did in last 2 years or something like that. So it is arranged in one folder. That's why it is easy to follow on, and also effective for showing. Suppose somebody asks you, and they are reviewing your activities for the last 2 years. How will you provide? You will provide in the form of a folder, so that it will be very easy for them to check whether you have attended research workshops, basic life support, some teamwork activities, some technique learning activities. So it will be at minimum cost. It is not requiring any extra certificate or extra effort. It will encourage the culture of support and recognition. It will be recognized if somebody see your portfolio. Suppose this is a folder. You have so many things in it. So if somebody see it, oh, he is good in research. He is good in computer. He is good in use of technology, something like that. They come to know from your portfolio. And also they will easily point out your unutilized skills, something which you have learned already, but you are not applying it in the practice. So your employer may give you tasks related to what courses you have attended in the as a CPD. Okay. Building on the existing resources. Suppose you have learned basic life support course this year. Next year, you should go for advanced life support, advanced ACLS or ALS, advanced life support. So based on your record, you will know that I have already covered stage 1, so I should go for stage 2 or stage 3, something like that. Signaling needs for the change within the school. Suppose you are not learning certain techniques, so your record will show, and then your organization may tell you to attend some new activities. Okay. People are investing in you. They are hiring you, so you are providing you are providing services to them. And if you don't provide the proper services, they will ask you to go for some courses. Okay, so this is the investors will ask you that no, we need people with some new techniques, so you should learn. And also for self-evaluation, I should evaluate myself every year. What I learned this year, what I should learn next year, what is lacunae in me. So this is the evaluation will be done by seeing your portfolio. So these are the advantages of keeping the portfolio. Are you following? Are my slides moving now?
Yes.
Okay.
Yes, they are.
Yeah, same thing in what I learned, what I described in the previous slide. It is here also. Why to keep the portfolio? Why I should keep a record? Okay. So same thing is repeated here in different terminology, reminding yourself about the quality of work. Suppose I see last year's my record, how many CPD activities, how many seminars, how many workshops I attended. Just if I go through my record, it will tell me, oh, I have done so many things. I have learned some basic things. I have to learn some advanced things, something like that. So it will be giving you me proud also, self-esteem, sense of self-esteem. And also based on your activities, you may go for some new jobs. Suppose you learn something very unique and it is not available in your institute or in your workplace, and you can utilize that it applying to the other institute. Okay. Your all CPD activities is a mean of learning, gathering the information that what you learn and what you have to learn in the future. When somebody see your portfolio, they will discuss it. Oh, this man or this doctor has got so many talented activities, so many activities. He's good enough. So it will come in discussion. They may give you some new responsibilities based on what you have already learned. And performance review, if somebody is reviewing your activity, reviewing your performance for the whole year, this is very common. If you are in a job, they analyze you at the end of the year, and they rate your activities. They rate from, let's say, from 1 to 100. These are the points. If you are getting, suppose, 50 points, they may not renew your contract. But if you are getting out of 100, let's say you got 90 points or 97 points or 93 points, so they may continue you as a job, or maybe they will increase your salary, or maybe give you some extra position based on what you learn during your practice as a performance review. This is called as performance review. At the end of the year, they check this man is learning new things or not. Okay. As I told you, the logbook or portfolio, it is a folder. It is a folder. It can be a folder in computer, or it can be a physical folder. Okay. What things should go in this folder? What things should go inside this folder? Your job description, your CV, curriculum vitae. CV means curriculum vitae. What is your qualification? What is your license number? What are the research papers you have done? What is your degree? All these are mentioned in a CV. So the CV, updated CV. Up to date means updated. Today, in this year, up till today, what new things you learn is addressed in this CV or entered in this CV, and you put this in a folder, or a box, or electronic folder. You keep the record. This is called as portfolio. So these are the things which are part of the portfolio. Your certificates, suppose you got certificate of attendance, certificate of qualification, your performance review. If suppose your employer review you at the end of the year and they gave you 99% mark. So this letter will also go in this folder. Some lectures or some lessons you have given. So reports of that can be a part of that folder. Examples of your uh, own work. Maybe you prepared one lecture. So that lecture can be put in this folder. Your presentation, PowerPoint presentation, or any other presentation can be a part of this folder. If you have published any paper or research article, this will also go in this folder. Suppose you are assigned head of something, head of committee, head of unit, that letter will also be a part of this folder. Whatever courses you have attended, so all these shahada should be placed in this activity, in this folder. Somebody may be given you thanking letter. Suppose you gave a lecture for kids, or in the school, or in a mall, giving some health information, and they gave you a letter that thank you doctor for your contribution, so and so and so. This will also be going to the part of portfolio. Thank you notes, even photographs will also be a part of this record. This record is known as personal development portfolio. This is personal development portfolio. We have already covered a reason why to keep this portfolio. Why to keep this portfolio? We have already covered. This is an extra. And here it is saying that this portfolio has to be updated. You have to add everything, whatever is achieved today, also in that folder. This is called as the hadith, or update, or jadid, tajdeed. All these things are kept in the folder as up-to-date knowledge. So this is about continuing professional development portfolio. Now The session is open for discussion, question, answers. Any question, anything you want to ask me? Otherwise, I will ask you. Are you with me?
Yes, Doc.
Yes.
Yes. So tell me, what is the point or who will summarize today's lecture? Some points. 1, 2, 3, 4. Tell me. Who's going to tell me what you learn in today's class? Anyone can start. You did not get any new point? Yes. Who? Summarize.
The
Ah.
aims of continuing professional development as well as learning what a portfolio is and how to make one.
Mhm. And what is the definition first? What do you understand by continuing professional development portfolio? Or continuing professional development. What is mean by that?
It's a self-directed learning.
It is a self-directed learning. Very good. Anything other than your actual degree. You are not taking admission to any college, but still you are learning by attending seminar, conference, workshops. This is known as continuing professional development. Okay, this is one thing. This is the what is the difference between continuing professional development CPD and CME?
CME is a part of CPD.
CME is a part of CPD. What is CME?
Mainly knowledge and skills.
Mainly knowledge and skills related to
Yeah.
medicine. Related to medicine. Okay, good. And CPD is everything. Knowledge, skills, plus everything. Other than that, maybe you are learning teamwork, you are learning communication, you are learning leadership, all or managerial skills or any soft skills, communication skills you are learning. This is also a part of CPD. CME is only for knowledge and skills. CPD is broader term. Anything which you learn to improve your profession. This is called as CPD. Yes. Okay. What are the things to be there in the portfolio, or what is portfolio means?
It's like a folder. You put everything in it, like achievement or any personal development.
Yes. So the record of all your activities, all your CPD activities, which you do every year, every semester, you keep it record. That record is known as continuing professional development portfolio. What it should contain? It should contain any certificate which you gain, any letter which you gain or you receive, letter of appreciation, letter of thanking, or a PowerPoint presentation, or pictures, or research paper, and your CV. All these are part of that folio or the folder. This is called as portfolio or logbook. Okay, why you should do CPD? Why you should do CPD? What is the aim?
For growth and motivation.
Yes, to maintain. First of all, whatever things you learn during your MBBS or post graduation, whatever you have learned, first of all, you have to keep it, maintain. And next is to improve on it. First of all, maintain it and also add to it. This is the aim. And who will be responsible? You are the one only. As a doctor, I am responsible for my own CPD activity. And also, it is based on why I should go for CPD activity? Maybe the patient which I am treating them, they need these qualities. Maybe they want their doctor to be having good communication skill. That's why I have to learn. They want their doctor to be perfect in handling some instruments. So this is the requirement. Maybe the employer where you are working, maybe it is the demand from the employer. So either from the patient or from the employer, and as well as not only these two, as well as for your own satisfaction. Sometimes you are not satisfied the way in which you are working. So maybe you want to improve. So personal satisfaction, employer demand, and patient's demand. All these are the motivation or the causes of doing CPD activity. Okay. It is not for gaining extra money. Please keep in mind, if something is asked in the exam, what should be the aim of your CPD activity? Don't take that to increase money, to increase wealth. No, these are secondary things. This is the not primary. This will automatically come if you are giving proper good service. People will pay for it, but it is not the only aim. This is not the first aim, primary aim. Primary aim is to provide good health services to your patient, to your society, to your country. Okay. So financial things are not coming in CPD. CPD is not because of I want to have more money, I want to increase my salary. No, automatically it will increase. If you are a good doctor, they will pay you more, but this is not the primary. Okay. Anything you did not understand in the lecture, don't go word by word from the slides. Even if you understand the concept, you will be able to answer it. So, is there any difficulty in this lecture? Okay, so announcement for the exam. Your exam will be on Sunday. Inshallah, it will start at 9:30. I will send you the hall numbers and the list of students which are there in a particular hall. Some 3 or 4 halls are for girls and 5 different halls for boys. So you should follow the hall number, and according to your hall number, please go there at least 10 to 15 minutes before the exam. Exam will be on Sunday, and it will be for 25 marks. Number of questions will be 30, and the result will be declared not for 25 marks. It will be declared for how many marks? 30 marks. How come 30 marks will come? 30 marks will come after adding your assignment number 2. So 25 marks for your exam 2 and 5 marks for your assignment 2. This will give you 30 marks. So out of total 30 marks, your result will be declared. So suppose if you got 27 marks, that means it is included. Maybe sometimes students think that I have not added the assignment marks, so they can contact me anytime. If you think that my marks are low, or maybe I forget to add the assignment marks, which I usually don't do. It is based on your response only. Suppose sometimes you don't do the assignment, so it will not be included. Your assignment will be the last date of assignment is on Sunday. The Sunday assignment will be closed and it will not reopen again. So please do the assignment before exam number 2, because your marks will be out of 30, including 5 marks from the assignment. Questions will be in the form of same like in the exam 1. Some questions will be MCQs, 4 options. Some questions will be MCQs with 2 options. Only 2 options, maybe secondary education and university education, like that. So which is applied here, or professional or unprofessional behavior, something like that. Okay. Here professionalism is not included. So what 5 lectures are included? 5 lectures will be included from lecture
From
number
6 to 10.
6 to 10. Today's lecture is CPD. So 10th lecture is CPD. Before it was assessment, then self-directed learning, problem-based learning, and one lecture from Dr. Amal, that is secondary education and university education. So these are the topics for the exam number 2. And exam will be, inshallah, it will be easy. Don't go by words. You have to know the English, because you will not find the same word which is there in the slide. At least you have to understand the meaning of the question. Okay. Any question now?
Doctor, is it going to be multiple choice?
Yes, multiple choice. Like as I said before, multiple choice means yani 4 options or 2 options. That's it. Either it will be A, B, C, D, or only A and B. So it is
Doctor,
no SAQ, no writing. Okay.
what is the date of the final exam?
Final exam date is not yet decided. Once it is declared, I will send it to you.
Okay.
Any other question?
Doctor, So doctor,
Yes.
you said the question 30, right? So 30 divided 25.
Yes.
So every question will be